So another category of the diseases of blood vessels are degenerative. So last time we are finished with the congenital category. No? Now let's go to the degenerative category of the diseases of blood vessels. So what are these examples? We have your atherosclerosis, we have your systemic hypertension, medial calcification, aortic dissection, and varicose veins. Okay, so let us go to this one by one. So atherosclerosis, no? Atherosclerosis belongs to the umbrella arteriosclerosis, no? Arteriosclerosis. So when you say arterio, it's blood vessel. When you say sclerosis, it is hardening. Okay, so it is hardening of the blood vessels. So there are three categories under arteriosclerosis. Number one is arteriolo, no? It's different from arterio, huh? Arteriolo sclerosis, Monckeberg's sclerosis, and atherosclerosis. Okay, so these three are under the umbrella term arteriosclerosis, meaning hardening of blood vessels. So the pathology here is tumitigas yung mga blood vessels. So let's go to this one by one. Okay. So when you say arteriolosclerosis, there are two types, no? So kasi arteriolo man, so they involve arteriole, so maliliit na blood vessels. Actually, this is the pathology of hypertension, no? So we have hyaline arteriosclerosis, we have hyperplastic arteriolosclerosis. So ano ang hyaline? So for example, this is your normal blood vessel, no? This is your endothelium, this is the lumen, this is the tunica media, as well as hindi defined masyado ang adventitia because arteriolo man ito, so maliliit man na blood vessel, so hindi masyado defined. No? So when you say hyaline arteriosclerosis, the blood vessel turned into hyaline deposition. So parang ganito. So parang mayroon na siyang deposition. No, hyaline material. No? Parang kumapal, it's thickened, but hindi na ang normal na components ng blood vessel, no? Because there is a hyaline deposition in the arterioles in the different layers. Kaya tinawag siyang hyaline arteriolosclerosis. Another form of arteriolosclerosis is hyperplastic, no? Hyperplastic. So we describe this as parang onion skinning. No? So nakakita na ba kayo ng sibuyas, no? If you cut the onion, so parang ganito ang hitsura, no? So onion skinning. So makapal din. Kaya nga arteriosclerosis kasi hardened and thickened. Okay? So these are actually the pathology of hypertension. This is for benign hypertension and this is for malignant hypertension. So imagine ang mga blood vessels mo ganito na, no? So makapal na sila, hindi na makakaadaan ang blood properly. So ganun ang mangyayari, no? Kaya mayroong hypertension. Okay. Next is Monckeberg's sclerosis. Monckeberg's derived from Dr. Monckeberg, Johann George, who discovered this disease entity. This is also known as medial calcific sclerosis. Therefore, where is the pathology? Dr. Borja? Mr. Borja? Mr. Borja? Mr. Borja? Mr. Borja? You are absent. Okay, Mlabatagos. So, Monckeberg sclerosis is also known as medial calcific sclerosis. So, where is the pathology? Labatagos, can you hear me? Ba't hindi kayo
I don't-
sumasagot? My God.
Tunica media po, Doc.
Oh, Mr. Angge.
Tunica media, Doc.
Andiyan na ang term, medial. Therefore, tunica media ang problem. No, ano bang mga layers ng blood vessels? Intima, media, externa, or adventitia. Therefore, the problem here is in the tunica media. Kaya nga may term na nga medial calcific sclerosis. Okay? And what happens to the media? There is a calcification. Presence of calcification in the tunica media. Okay? So, Joanne, mark absent yung hindi sumasagot kanina.
Noted po, Doc.
Thank you. Okay? So, this is a blood vessel with medial calcific sclerosis or Monckeberg sclerosis. The pathology here is deposition of calcium in the tunica media. So imagine mo, no, if your normal blood vessel is replaced, the tunica media is replaced by this calcium, titigas talaga yan, no? Titigas ang blood vessel mo. So this is a form of degenerative problem. So marami ito, no? As we get older, above 30 or 40s, ang mga blood vessels natin ay nagkakaganito na. So how can they function well kung ganito ang may calcification na ang blood vessels mo? Okay? So if there are calcification, remember your media is for contraction. Okay? So another picture showing medial calcific sclerosis or Monckeberg's sclerosis. Okay? So there are calcifications seen in the media. Ang question dito ay, is there a possible obstruction of the blood flow? Miss Makamay.
Hello po, Doc.
Yes.
Showing basing from the image, wala po.
Yes, no? Very good. Walang obstruction kasi ang pathology nasa media, no? Nasa media. So ito man ang lumen natin, si they don't actually affect the lumen, so kumakapal lang ang media, the blood can go in and out. Kaya lang, ang problem lang natin dito ay ang contraction, no? Hindi na siya masyadong maganda ang blood vessels. So there is no obstruction. Very good. Next. Next to Monckeberg's, we have atherosclerosis, no? So this is actually the most common disease problem, no, in our century, no? Mayroon siyang atherosclerosis, ganyan-ganyan. So can you hear some of your friends, no? So ano ang atherosclerosis, no? So atherosclerosis is a problem, no? It's a form of your arteriosclerosis wherein it does not develop overnight. No? Take note, hindi siya overnight. So, hindi nga kumain ka lang ng lechon kahapon, bukas po may atherosclerosis ka na. Hindi po ganon, no? Kumain ka lang ng crispy pata kanina, Mr. Angge, no? Mamaya may atherosclerosis ka na. No, no? So your atherosclerosis, mayroon niya kung baga story, no? It starts from a fatty ducts. So take note ha, dot. Alam naman natin kung ano ang itsura ng ducts, no? Next, it's after that, kung kain pa rin ng kain, so deposition pa rin. So, naging streaks. Ang dots naging streaks. Then later on, kasi ganun pa rin, no? Or if you're really prone, no? For atherosclerosis, nagiging plaques. Yan. Which is the characteristic lesion of your atherosclerosis. It's called an atheromatous plaque. Okay? So, this is an example of a fatty dot. So, hindi po maganda ang baby na ganito kataba. No? Kasi remember, ang atherosclerosis, it is a sequential event. No? So, it starts from childhood or infancy. Kasi pag paganahan natin ng baby natong pakaon, match, no? Ganyan ang mangyayari, no? Ilang layers ba yan? 1, 2, 3, 4, 5, no? So, imagine mo ang mga deposition ng fats na yan. No? So it starts from bata pa tayo. no? Kaya hindi po masyadong maganda na mataba talaga ang baby. So dapat ideal weight for the age ng infant or babies, no? Kasi look at this, no? Kasi from this age nagkakaroon na talaga ng fatty dots. So when you say fatty dots, o sino ang mga baby na ganito kayo noon? Ha? Mga throwback pictures ninyo na ganito kayo kalaki. Mr. Pideri, ganito ka ba kalaki?
No po, Doc.
Hindi, mas malaki ka pa.
I
Mas
was
malaki ka.
10 po.
No, what I mean is dapat talaga ideal weight. No, kasi ang atherosclerosis, it starts really from our childhood. Hindi lang po na kahapon na namiesta kayo or ng birthday or whatever, no? So from this age, nagkaka-develop na ng fatty dots. Okay? So when you say dots, they are less than 1 mm in diameter. So they can be multiple, flat, kaya nga dots eh, dots. Then, they're nothing but they are lipid-laden macrophages. So group of macrophages. So maraming macrophages na punong-puno ng fats. No? It starts from birth up to children. Okay? So when you examine the blood vessels of patients with fatty dots, sometimes grossly they cannot be visualized kasi dots pa lang yan. Okay, but that's the starting point. That's the trigger in your atherosclerosis. So pag ang dots nag-progress, it will become a fatty streak. Okay? So when you say a streak, okay, it's bigger now. No? It's more than 1 cm long and they are elongated component, no? Lipid-laden macrophages. Kaya lang may dagdag na dito, mayroon ng lymphocytes. Okay? And fatty streak is considered as the earliest lesion of atherosclerosis. No? So again, there is no obstruction pa dito kasi streak pa man la. Then, these are seen in the adolescence. No? Then, pag wala pa rin, pag nag-progress yan, so this is an example of a fatty streak. So can you see the fats? So this is a blood vessel. Di ba ang blood vessel is a tube. No, inopen na yan, kaya flat ang itsura. So baka magulat din yan ang blood vessel, no? So it's opened already. Then you can see the yellow streaks here. Can you see the yellow streaks? Okay, so yan ang fatty streak. No, imagine mo, so mag-iipon yan, maiipon yan. So yan na yan, no? Yan, another fatty streak. Mas klaro, no? Mas klaro. So they are made up of lipid-laden macrophages and some lymphocytes. Okay. Pag wala pa rin ang fatty streaks, no? Nag-further develop yan, naging atheromatous plaques. Okay. Pag dumating na yan sa plaque, it is already the main lesion of your atherosclerosis. Okay. So ano naman ang anatomy of atherosclerotic plaque? Meaning ano ang components? Ano ang nandoon sa atherosclerotic plaque? So this is a classic atherosclerotic plaque. Kasi minsan ang plaque na yan puro na lang fats. Minsan pag matagal na rin yan, nagiging calcified na yan, puro na calcium. Okay? But this is the classic anatomy of atherosclerotic plaque. That there are two main components. Okay, number one is a fibrous cap. No, ito ang fibrous cap niya. Then the core made up of lipids or a necrotic center. So ito ang classic, ha? Classic atheromatous plaque. Okay. Ang next question ko is, Sir Obejas, is there a possible obstruction?
Basing from the image to, wala pa do.
Wala pa?
Wala.
Are you sure? Are you sure?
Possible, Doc, na may obstruction since nagbuti ang diameter ng lumen.
Yan, oo, mayroon. Okay, therefore, where is the pathology of atherosclerotic plaque? O, balik tayo, Ms. Labatagos. I'll give you a chance.
Ano po daw kung pag-ana? An pathology?
Oh, yes.
So, since nagkakamay naman Dok kinin deposition hand plaque, and yellow men
Oh, therefore, nasaan ang pathology? Kung given a blood vessel, saan ang titingnan mo?
wall and then unlongen.
Saan ang wall? Kasi when you say wall, ang daming layers ng wall.
And intima po Dok.
Yan, okay, very good. Ayan na, oh, may word na nga na intima. So the deposition of the plaques is in the intima. Remember, intima, media, and adventitia. So therefore, kung dumamo itong sige ang tambak, mababara talaga ang imolumen. Nakuha niyo? No? So pag kumapal na itong fibrous cup, kumapal itong necrotic center, ang blood vessel, ma-lilesen ang diameter ng lumen mo. So it can cause obstruction. That's why pag may mga atherosclerosis, no, nababara, di rin nakakadaan ang blood. Di ba? Or the atherosclerotic plaque, ang pinakadelikado, no, it can be carried away to the different parts. Because, di ba, daman sila sa intima. So may dumating na blood, a sudden gush of blood. So pwedeng matanggal ang atherosclerotic plaque mo. It can, yan ang delikado, no? Kasi patay ka agad ang pasyente. Pag napunta yan sa lungs, pag napunta yan sa heart. It is an atheromatous embolism. So patay ka agad ang pasyente. Kaya mayroon kayong makikita, collapse na lang ang pasyente, namatay. So yeah, one of the cause. Okay? So ito ang normal anatomy of atherosclerotic plaque. Again, this is the classic, ha? Kasi pwede na ito ma-derange, the pathology can be changed, baka nag-inom na ang gamot ng pasyente. Second is, nasanay na ang blood vessel na niya. So naging calcified na yan. Okay? But if you're being asked, ano ba ang normal composition ng atherosclerotic plaque? Number one, mayroon siyang fibrous cup. And second is a necrotic center. No, a necrotic center made up of lipid core. Okay. So the intimal lesion is called the atheroma or the atheromatous plaque. Okay? So it protrudes into the lumen. So that's why may obstruction. No, kahit lang 25%, 50% ng lumen mo, may kaunting obstruction na yan kasi hindi na normal na nakakadaan ang blood vessel mo. So it affects from the highest to the lowest, no? Your abdominal aorta, coronaries, popliteals, internal carotid arteries, and circle of Willis vessels. Okay. Then, what are the risk factor? So, when you say risk factor, it is a variable that is causally associated with an increased rate of the disease. And take note, it is an independent, significant predictor of the risk of developing the disease. Okay. So, what are the risk factor? And currently, no, meron tayong dalawa. The non-modifiable and modifiable risk factors, no? So, common sense naman siguro kung ano ibig sabihin ng non-modifiable, no? Male gender, advanced age, and family history. Question, bakit ang male lang, wala ang female? Miss Curitana, sino yung sumagot? Sorry. Hello?
Hello po.
Choppy ka. We cannot hear you.
Hello?
Yes, okay.
Lifestyle po, Dok. Ang kanan male po.
Ano man?
Kuwan po, Dok. Yung lifestyle po ng male is parang mas ano po siya, bagan mas hataas po ng risk mag-atherosclerosis. For example po, Dok, mostly ang nag-smoke po is male, tapos ang mga nag-ano po.
Because of smoking. That's
Ang
what you want
lifestyle
to
po.
say? Bakit may mga female naman nag-smoke?
Oh, hello po, Doc. Good
Yes?
morning. Coritana,
Yes, Ms.
Um,
Maritana.
It's because po, Doc, females have estrogen, and estrogen has been founded to have a
Yes,
protective
very
effect.
good. Mga protective
Opo.
effect for
Yes
atherosclerosis,
po,
no?
Doc.
So that's why mas risky ang male because kaunti or wala ang estrogen level, no? Then there are modifiable. No, under modifiable naman may major, may minor. Meaning you can modify this, no? If you stop smoking, if you lower your blood pressure, if you maintain your sugar, and if you maintain your lipid profile or contents in your blood, no? So minor are homocystinemia. So bago lang ito. So these are seen if you have a lot of homocystinemia in the blood, you are risk for atherosclerosis. Of course, obesity. If you lower your weight, no? Then hypercoagulable state, which is related also to hypertension and hyperlipidemia, and physical inactivity. So this can be changed. This can be modified. Okay. So there is a new one now, no, that we have they call it now unmodifiable and modifiable, no? So may range yan, no? May range. So of course, unmodifiable, you cannot modify this. So hanggang dito, no? So, ito nang bago ngayon. Meron ng modifiable. Another one. Okay. Note that homocysteine, no? Homocysteine is a cause now of risk for hypertension, atherosclerosis. Why? Now, because if you have a lot of homocysteine in the blood, it can cause oxidative stress. Okay, cytoplasmic calcium will influx. There will be a cellular apoptosis and endothelial dysfunction. Now, remember your blood vessels are lined by endothelial cells, no? So if you have a lot of homocysteine, nasisira ang mga endothelial cells. So, prone, open na ang blood vessel mo, sira na ang endothelial lining. No? So, anyone can go in and out. That's why homocysteine is a risk factor. Another is microbiota. No? So, they say that if you have a dysbiosis of the commensal gut microbiota, this can cause also a risk factor for atherosclerosis. No? Meaning, we have a normal, no, gut flora. No? Meron tayong gut flora, normal yan. But if they are deranged, no, there's now a dysbiosis, meaning kanya-kanya na sila, wala na silang commensalism. So this may mga studies na ngayon that they can be associated with risk factors in atherosclerosis. So this dysbiosis can develop through your obesity. No, syempre mataba na, no? So kaya hindi na nakikilala ng mga normal flora doon. Okay. Next, itong mangyayari, no? So inflammation. Inflammation also can be a part of your atherosclerosis. So maraming factors, no? So ito, pollution. So air pollution, environmental problem, they can be also associated now with atherosclerosis. So proven na, no? Kasi may mga studies na molecular studies that they can be a risk factor for atherosclerosis. No? Infection. So mayroon na ring mga organisms na na-isolate in the atherosclerosis. Common are your cytomegalovirus, the pneumonia, as well as, your herpes simplex virus. So these are the 3 microorganisms associated now with atherosclerosis. And their pathophysiology is shown here. Okay? Then what are the complications of atherosclerosis? So syempre kung ito ang blood mo, normal, so walang nakakabara. So ito may kaunti lang, so fibrous plaque. So almost half na. Then ito talagang buo na, no? So the complications are thrombosis, no? So may imbak ang blood yan. So hindi man makadaan, no? They cannot flow. So they will have a thrombosis. Then plaque rupture. So yan nakakatakot, no, pag mag-rupture ang plaque kasi it can go anywhere. Okay? So pag mag-rupture na yan, may hemorrhage. no? Then mayroon na wall weakening kasi mayroon ng mga nandyan eh. So, it can also rupture. So, any substances can go in and out. Then, it can calcify. No? Then, clinical manifestations, syempre kung barado, you can have a myocardial infarction. No, heart attack. No? Or cerebral infarct. Then, gangrene in the extremities and abdominal aneurysm. Kasi hindi na nga maka-flow ang blood because they are obstructed or blocked na ang mga blood vessels. Okay? So what are the hypotheses of atherosclerosis? So a lot of hypotheses. So we have incrustation, insudation, monoclonal, response to injury hypothesis, and the explanation on this side. But the most favored is the chronic endothelial injury. No? This is the most favored hypothesis, which is true for me. Kasi, pag may sira ng endothelium mo, common sense lang yan, no? So, anyone can go in and out. Kasi wala ka ng lining eh. Sira ng endothelium mo. Okay? So, anyone, any substances can go in and out. Derange. Therefore, ang ending point niyan ay deposition. Kaya I also favor this chronic endothelial injury hypothesis. No? So marami, no? Pag may endothelial injury ka, it can cause endothelial damage. So yan, may hyperlipidemia, infection, inflammation, etc. So deposition. So detailed, no? The interplay of the different cells if you have endothelial damage. So may role ang macrophages, may role ang T cells, may role ang platelets, no? So these three, if they well activate, it will form really your atherosclerotic plaque. Okay? So questions? So we are done with atherosclerosis. Go to the systemic hypertension. So I already mentioned the systemic hypertension kanina, the pathology. But they're divided into three: the essential, the benign, and the malignant or primary. Okay. So the essential is the most common, 90 to 95%. This is due to the aldosterone mechanism gene defects, no? So pag may problem ang aldosterone, no, review in your physiology the mechanism of aldosterone, as well as the mutation of the sodium reabsorption. Okay, so this is also known as the primary essential hypertension. Next is the benign hypertension, wherein identifiable or organic ang cause. No? So meaning we have different medical condition na makaka-cause ng hypertension. This is the secondary hypertension or a benign hypertension. There are also drugs, no, that are associated by causing secondary hypertension, shown in this long list. No? And the third type is a malignant hypertension. This is also known as the accelerated type of hypertension. This is rapid, and this is also called malignant if there is already an end organ damage. Okay? So ito ang classification. How about the pathology? So as I mentioned kanina, the pathology of hypertension is in the arteriolosclerosis. No? It can be a hyaline, and it can be a hyperplastic. No? Pag benign hypertension, usually mga hyaline type of arteriolosclerosis yan. Pag malignant or accelerated type of hypertension, ang mga blood vessels nila ay ganito na ang hitsura. Onion skinning. Or may mga necrosis na yan in the walls of your blood vessels. Okay? So we are done with systemic hypertension. We are done also with medial calcification. Medial calcification, ano ang other name? Mr. Aporio?
Dok. Dok, because choppy kasi kanina itong apart another name. Basta nakadetudok middle. Nag-choppy kasi, I'm sorry.
Ano ba yan? Oh, Mr. Bonggalon.
Oh yes, Doc, monkeybergs.
Yeah.
Monkeybergs hypertension.
Monkeybergs, arteriosclerosis. Diyos ko. So we are done with systemic, medial. Let's go to aortic dissection. Ano ang aortic dissection? So when you say aortic dissection, it is the entry of blood under high pressure into the aortic media through an intimal tear. No? So normally, dapat walang blood dyan, di ba? Tunica intima, tunica media, tunica adventitia. If there is a sudden gush of blood into the tunica media through the destruction or intimal tear, it is called an aortic dissection. Patay kaagad ang pasyente. No? So, that's what we term aortic dissection. So, what are the causes? The number one cause is, of course, hypertension. Pag mataas masyado ang pressure, no? Sudden gush of blood, nasisira ang mga intima. Okay? Pag sira ang intima, sira ang endothelial cell, the blood can go in. No? So remember the myxomatous degeneration of the media. No? So di ba may mga cystic spaces na ang media mo? So open na siya, ready to accept. So the blood can go in. Same also as your connective tissue diseases, just like the Marfan's and the collagen diseases. Okay? So the pathology of aortic dissection is due to the intimal tear. So the blood dissects between the layers of the smooth muscle in the media. Okay, so this is another example. Normal. No? Then you have here intimal tear, the dissection of blood into the lumen. Oh, mas klaro ito. Just the high power view. You can see the media, a lot of blood vessels or blood here. Okay, it's called aortic dissection. So the patient clinically will present sudden severe pain, and it is retrosternal in location. And it can mimic also myocardial infarction. So akala ng iba, nag-atake lang siya. Yung pala, nag-aortic dissection na. Okay? So some have massive retroperitoneal or mediastinal hemorrhage. Okay? So we're done with aortic dissection. Let's go to the last part of the degenerative, which is the varicose veins. Okay? So I hope nakakita na kayo lahat ng mga varicosities of the veins. No? So sa mga friends ninyo, relatives, or your patient, you can see this varicosities. No? So when you say varicose veins, these are abnormally dilated and tortuous veins. No? The most common location is in the legs. But varicosities can occur anywhere. Take note. They can occur anywhere, any part of the body. They can occur anywhere. But usually, ang nakikita natin ay sa mga legs. No? Kasi ito man exposed areas. So you can see the classic varicosities of the vein. So this is believed to be a degenerative process. So as again, sa legs ang most common. You can see them in the rectum, esophagus, stomach, and spermatic cord. Okay. Then the risk factors are older age, kaya nga degenerative siya, female, fluidity, posture, and obesity. So sa zoom natin, sa kaupo, pwede tayong magka-varicosities. Na? Kaya tayo pag may time. No? Pwede tayo tumay. Pwede tayo tumay. Or move your legs. No? Move your legs. Ang problem kung hindi sa legs, nag-develop sa rectum ang varicosities. No? So as I have said, the most common location is in the legs, specifically your superficial saphenous veins. No? So this is due to the obstruction of the deep veins and incompetence of the valves in the saphenous and the perforating type of veins. Okay? So we are done with the degenerative. Let's go to the inflammatory type of categories of the diseases of blood vessels. Okay? So what are inflammatory? So when you say this infection of the blood vessels, we term it as a vasculitis. No? Inflammation of blood vessel or a vessel that is either non-infectious or infectious. No? Take notes, even though it is called itis, no, when you say itis at the ending, it means inflammation, di ba? Inflammation. So, blood vessel, vasculitis. But even though it's vasculitis, there are non-infectious cause and the infectious cause. Okay, for the non-infectious, these are autoimmune mostly and idiopathic. For infectious causes identified, no? The microorganism, gaya ng bacterial, fungal, and secondary to these different types of infection. So vasculitis can be classified in many ways. But in pathology, we used to classify blood vessels, vasculitis, based on the size of the involvement of the blood vessel. Okay? So they can be a large vessel vasculitis, meaning involving the aorta, or they can be a medium vessel vasculitis if they can involve the arteries and the arterioles. And if they involve a smallest type of blood vessels, they are called small vessel vasculitis. Okay. So in this slide, it's a very good example, no? Because given the type of vasculitis, mayroon specific, no? For example, large vessel vasculitis, no? Example of that are your granulomatous diseases, giant cell arteritis and Takayasu arteritis. Okay? Whereas for medium vessels, they are divided into two, immune complex and anti-endothelial cell antibodies. Now, an example are PEN or the polyarteritis nodosa and Kawasaki disease. For small vessel naman vasculitis, they are also subdivided into two. The immune complex, positive immune complexes and immune complex mediated. Okay? So let's go to this one by one. So in vasculitis, we have what we call mga immune complex mediated. So we have what we call the T-cell mediated diseases. So meaning the pathogenic T lymphocytes responses and cell-mediated immunity plays a role in some granulomatous vasculitis. No? Examples of this here, no? The immune complex, and also here, no? The immune complex is small blood vessels problem. No? So large vessel vasculitis muna tayo. For large vessel, there are also, aside from immune-mediated, we have also immune complex deposition. So these are the different pathology na bakit nagkakaroon ng vasculitis. For the immune complex deposition, so mayroong deposition of immune complexes. So deposition of immune complexes in the blood vessels, which can cause activation of your complements, therefore destruction of the vessel walls through acute and chronic inflammation. Example of this are your immune complex mediated here and immune complex mediated in small vessel vasculitis. Okay? Then mayroon din antibody mediated. So these are the different pathogenesis, no? So when you say antibody mediated, there's now an anti-endothelial cell antibodies which are believed to play the central role, no? Example here is your Kawasaki disease, no? Which is an anti-endothelial cell antibody pathogenesis. Okay. Then mayroon din ANCA associated. So later on, we will go on to ano ang ibig sabihin ng ANCA, ano ang types ng ANCA. Okay, so when you say ANCA, this is an aberrant expression of your proteinase 3 and MP over the surfaces of your neutrophils. So pag nandiyan sila, they are prone to develop or form antibodies. So therefore, destruction of the neutrophil, they will attack the blood vessel and there will be vessel wall damage. So usually dito yan, no? Immune complexes associated with ANCA. Okay? So those are the four pathogenesis for vasculitis. So ano ang mga ANCA na yan? So there are two types, no? The C ANCA and the P ANCA. So this is called C kasi cytoplasmic, no? Serum protein, patients bind to cytoplasmic granules And they attack the proteinase 3, which is the major antigen. Okay? Your proteinase 3 is a serine protease and present in the azurophilic granules of the neutrophil. So nasa cytoplasm sila. And the P-angka naman, tinawag siyang P kasi perinuclear. Perinuclear staining pattern on the MNs. Then ang target naman nila is myeloperoxidase. Ito, proteinase. Ito, myeloperoxidase. So they are normally involved in generating oxygen-free radicals and present in lysozymes. Okay. So P-angka, ano to? Perinuclear. So look at the staining in the immunofluorescence. So they are perinuclear. Whereas C-angka, cytoplasmic, and they are diffusely granular. Okay? So lahat yan na green in the cytoplasm of the neutrophil. So we can see only ANCA if we do immunofluorescence. No? Yan. So let's go now to the individual type of vasculitis. So let's start with a large vessel. For the large vessel, we have what we call a granulomatous vasculitis. Under granulomatous, we have two types, the giant cell and the Takayasu arteritis. So this is a giant cell arteritis. Nakita na ba kayo? Usually, andito sila sa forehead, no? That's why this is also known as temporal arteritis, no? So for those mga oldies, no? So tingnan niyo maraming mga dito, no? So you can see enlarged blood vessels and very prominent, usually in the temple. So they are granulomatous necrotizing inflammation, no? Characterized by the thickening of the intima, inflammatory cell infiltrate, and skip lesions. No, usually 60 to 80% of patients will have a positive temporal biopsy. So, anong itsura niyan? You can see ito na ang nangyayari sa blood vessel. So, since this is a granulomatous type of vasculitis, you can see granuloma. So, there are granuloma here, then there are multinucleated giant cells, and there are criteria in the diagnosis, no? Number one is the age, it must be more than 50 years old. Then clinically, mayroon siyang onset of localized headache, and temporal artery tenderness, or decreased temporal artery pulsation, elevated ESR, usually more than 50 millimeters per hour, and positive for temporal artery biopsy. No? Meaning, ito ang makikita natin na histologic features. So this is called temporal arteritis. Okay. Another is a syphilitic aortitis. No? So syphilis can cause large vessel vasculitis, no? Especially kung late or tertiary type of syphilis na yan. So anong mangyayari? So your blood vessel, this is the wall of your blood vessels, is opened up. So, para na siyang tree bark. No? Nakakita na kayo ng tree, no? So, parang ganyan ang mangyayari sa blood vessels if you have syphilis. No? So, you can see, of course, lymphoplasmacytic infiltrates around blood vessels and nerves, as well as this type of inflammation. Okay? Then, Takayasu, another large vessel arteritis. So, when you say Takayasu, it is a panarteritis, meaning all of the layers of blood vessels are involved, having inflammatory mononuclear infiltrates and occasional giant cells. No? There's an intimal proliferation, fibrosis, scarring, and vascularization of media, disruption of degeneration of the elastic lamina, and narrowing of lumen, and presence or absence of thrombus. So, ito ang mangyayari, no? Pag mayroong tawag nito Takayasu. Okay, so yan. You can see also giant cells here. Talagang mayroon na siyang occlusion, no? Kumakapal na kasi may intimal thickening, then may inflammation here, giant cell reaction. Okay. Next, let's go to the medium vessel vasculitis, no? The Kawasaki disease. Kawasaki, PAN muna tayo, no? For PAN, The pathology is immune complex mediated. So when you say or polyarteritis nodosa, the blood vessels ay para silang nagiging nodular formation. Kita ninyo ang nodule formation here. So the pathology is necrosis of blood vessels, leads to the formation of the characteristic nodules in the blood vessels of the kidney. So usually they involve the blood vessels of the kidney. So in radiology, they're also called as the rosary sign or the string of pearl sign. No? Mga blood vessels yan. They form nodules, no, because of the necrosis of blood vessels. So yan, parang rosary, no? Sa problem in kaya tinawag siyang nodes, no? Parang mga little nodes. Okay, so this is a systemic necrotizing. It affects all medium types of blood vessels except lungs. So some will present subcutaneous nodules, which is painful, and livido reticularis. And they're associated with hepatitis B and C infection, as well as parvovirus 19 and HIV. Okay, so ito ang patient with polyarteritis nodosa. No? So then you can see nodes. So may clue. No? Then the early lesions, mga fibrinoid necrosis yan. So look at that. So ano na ang mangyayari sa mga blood vessels mo pag ganito na? Of course, may occlusion na yan later on in advanced lesions. Now, another medium type is Kawasaki disease. No? Common. It can be seen, no, because of the superantigen exposure to HSP65. So ang common target ng Kawasaki are the coronary vasculite blood vessels and medium type of blood vessels. So there are criteria to diagnose, 4 out of 5, no? Clinically, no? May conjunctivitis, may rash, edema, adenopathy, and mucosal involvement. So ito ang itsura classic, no, presentation of patient with Kawasaki disease. So mapula. So mapula sila. So we call strawberry or the red heart physical finding. So mapula ang mata, mapula ang lips, mapula ang pisngi, no? So ganyan. So siya, classic lesion. Okay, so you can see here, no, the conjunctivitis. Okay, the strawberry tongue. So ang pinaka dreaded complication lang ay coronary aneurysm, but this is treatable, no? If you give steroids, so the patient is really responsive. Okay? So the pathology is associated to be viral, also associated with aspirin, and acute necrotizing vasculitis. Okay, so ganyan ang mangyayari, no? Next are the small type blood vessel vasculitis. The small type vasculitis are subdivided into 2, associated with ANCA and those with immune complex mediated, no? For those associated with ANCA, we have 3, no? If may granuloma, then may asthma, it is called the CFV, no? If may granuloma pero walang asthma, it's Wegener's granulomatosis. Pag walang granuloma, pag may asthma, it is called MPA. So the 2, no, is associated with P-ANCA, whereas the WG is associated with C-ANCA. Okay? So what are, ito ang mga clues, CSG, WG, and MP. So we have Church-Strauss, Wegener's, and microscopic polyangiitis. Okay, so how about a small type of vasculitis with immune complex? The 2 classics are Henochian line purpura and the good pasture syndrome. Ano ang Henochian line? So ang Henochian line purpura is due to the deposition of IgA, no, in the blood vessel. Usually ang target niya ay blood vessel, no, and the glomerulus, no, and the glomerulus. So remember, your glomerulus are capillaries. They are top of capillaries. So therefore they love to involve the glomerulus. Therefore kung may HSP ka, may vasculitis ka na, in the systemic vasculitis, mayroon ka pang kidney problem. So, because of the IgA deposition. Okay? So, IgA deposition in the glomerulus, ito, makakita ka ng IgA deposits in the mesangium. So, we will discuss this when we go to the renal pathology. No? So, sa skin, they will also deposits. No? Ang mga yan ay mga IgA. Kaya nagkakaroon ng mga, ang hinoxion line may mga purpuric rash. No? So, this is an example of a purpuric rash due to IgA deposition in the skin. So it is called a leukocytoclastic vasculitis kung sa skin. Pero sa kidney, they deposits into the mesangium of your kidney. So leading into glomerulonephritis. Another small type is Goodpasture syndrome. Ang Goodpastures naman, may triad ito due to anti-glomerular basement membrane antibodies and the presence of proliferative glomerulonephritis plus a pulmonary hemorrhage. So Goodpastures develop because there is antibody-mediated attachment in the blood vessel wall. No? So pag nandyan sila sa blood vessel wall, they can attract neutrophils which can cause destruction of the wall. No? Inflammation of the wall. Kung meron na yung mga neutrophil. Then, ng blood vessel mo. Okay? Then, it affects mostly the lungs. No? The small type of blood vessels of the lungs. That's why in Goodpastures, may kidney problem ka, mayroon ka pang pulmonary hemorrhage. Okay? Then the last category of the diseases of blood vessels are neoplastic, meaning the tumors in the blood vessels. So what are the tumors? Benign. So benign tumors of the blood vessels are called hemangiomas. Okay? So they can be a neoplasia or a hamartoma. If small types of blood vessels ang nag-proliferate, we call it capillary hemangioma. Pag malalaki ang blood vessels, we call it cavernous hemangioma. But they can be a combination or a multiple hemangiomatous syndrome. Okay? A multiple hemangiomatous syndrome meaning may mga hemangioma ka plus other problem. Gaya ng von Hippel-Lindau syndrome, there are hemangiomas in the brain as well as in the retina. Okay? Then we have Sturge-Weber syndrome. We have vascular lesions in the brain as well as in the skin. Okay? So this is an example of a benign hemangioma. No? So yan, tumor of blood vessels, usually in the exposed areas. And if you get samples from that, nothing else but proliferation of small types and large vessels seen in this picture. So pag mga small type yan, capillary hemangioma. Pag malaki ang blood vessels, we call it cavernous hemangioma. Okay? Another tumor in the blood vessels is called the glomus tumor or glomangioma. So this is a benign, painful tumor of the glomus body. So glomus body are neuromyoarterial receptor which is sensitive to temperature and this regulates arterial flow. So they are most commonly seen in the toes, no, in the nails. You can see here a blood vessels. The whole thing is the tumor. And glumo, as you can see, this glomus body cells, no? Or this is a glomus tumor or a glomangioma. Okay? And malignant tumor of the blood vessels are called angiosarcoma. Okay? There are agents that can cause angiosarcoma, just like your thoraras, which is dye used for X-ray purposes before, the PVCs, then arsenic. So these are deadly substances which are proven to cause angiosarcoma. So they can occur anywhere, basta may mga blood vessels, and this is how it looks, no? So pangit na ang mga blood vessels. Then the endothelial cells are pleomorphic, and there are abnormal mitosis present. Okay? But the clue here is the blood vessels kasi may mga blood sa lumen. Okay? But the endothelial cells are malignant. Okay? So I think that's the end. We are finished on time for the diseases of blood vessels. Any questions?
Question po,
Clarification?
paano Doc ma-differentiate an aortic dissection na MI?
What is
Since di ba po-
myocardial infarction? Define myocardial infarction. So when you say infarct, di ba, lack of blood flow or lack of oxygen into the tissues, ischemia muna, no? Pag may ischemia na, prolonged ischemia, mamamatay ang tissue or organ, magiging infarct. Okay. So therefore, the pathology of infarction is a hemorrhagic necrosis or coagulative necrosis. Whereas your aortic dissection is the presence of blood in the tunica media. Okay, can you see now the difference?
Yes po, Doc.
Okay. A question. More questions.
Hello, Doc.
Yes.
Doc, about la po ang last slide and
Angiosarcoma?
Yes, Doc. Pa-clarify la po, Doc, kung hain po dito dapat and mga malignant na
The whole thing na pinakita
the
kong
whole
picture.
thing.
Oh, the whole picture, these are all malignant endothelial cells. So the whole, lahat yon. So
Thank
it's
you.
all an angiosarcoma. The whole tumor is called an angiosarcoma. Yes,
Thank you,
any
Doc.
more clarification?
Doc, I have a question, Doc.
Yes, sino ka?
About po sa aortic dissection po.
Okay.
Why do patients die instantly? Kasi you mentioned why do patients die immediately if they have aortic dissection? Kasi you mentioned kanina na if a patient goes through aortic dissection, namamatay sila agad.
Oo, of course, no? Kasi remember
Yes.
mo, siraan na ang blood vessel mo. So, sa sudden gush of blood, deranged na ang tawag nito blood flow, no? So some of this will develop collateral circulation, no? Imagine mo kung ang mga blood vessels na yan sa abdominal aorta mo, no?
Okay.
So that's why
Parang nag-rupture po, Doc. Ganun.
Oo, ang iba mag-rupture, ang iba naman maswerte, no? Pag medyo ma-stabilize pa ang pasyente mo, pero weak na ang blood vessel na yan. So remember, napasukan na siya napasukan na ng blood. So magra-rupture talaga yan, mag-hemorrhage, then syempre ayan na, mag-DDIC na ang pasyente mo, mamamatay ang pasyente. No? So yun
Okay.
ang cause.
Thank you po, Doc.
Okay, next. Any more? Wala na?
Doc, question, curious
Yes.
na. If hemangiomas, Doc, in time, adult age, naguti ba sila?
Yes, oo. So there are hemangiomas kasi they are benign, no? So ang iba, lucky na nagde-degenerate, no? Meaning ang later on lumiliit, then nawawala. But mayroon din talaga nagpi-persist. May nagpi-persist din ng mga hemangioma. So pag benign, just an excision will do. A benign excision will do, and it's okay for the patient. But it's true, no? Some nagre-regress, nawawala as time goes by. Especially kung sa mga bata pa, no? As they grow older, nawawala. Mayroon din ba nagpi-persist din naman? Okay, very good.
Pero di rin natin yamada ko, Doc.
Depende. Mayroon ding lumalaki, mayroon ding nami-maintain lang. No? So iba-iba. So depende. So the theory there is if there are cavernous type, usually lumalaki yan. Pag mga capillary type, yung maliliit lang blood vessels, hindi sila masyado lumalaki. No? For those cavernous type lang. Very good. Next.
Thank you, Doc.
Hello, Doc. Good morning po.
Yes, Ms. Bericio.
Question lang po, Doc. Doc, sa atherosclerosis, always po ba above normal yung lipid test sa blood chem?
Yes, oo. Kasi depende rin yan, ha? So, mayroon ding mga normal but they have already an atherosclerosis. No? Mayroon din namang elevated yan, then they can be correlated, mayroon din silang atherosclerosis. But the lipid profile is highly correlated with the presence of atherosclerosis. Pero hindi lahat ng may atherosclerosis abnormal ang lipid profile pattern. Okay?
Thank you.
Especially ba, I mentioned marami man ang cause ng atherosclerosis. Baka mamaya infection yan, inflammation from herpes virus. No? So syempre hindi masyado elevated ang mga lipid profile niyan. No? But for those really excess ang cause, no? Yung mga mahilig talaga kumain, yung mga obese, no? Yung may mga diabetes, no? So yun, correlated talaga na abnormal ang kanilang mga lipid profile. Then for those with homocystinuria, no, homocystinemia, so sometimes normal ang kanilang lipid profile pero mayroon silang mga atherosclerosis. Okay, next. Any more? One question? One last question, please. If there is.
Doc, hello po.
Yes, Ms. Makamay.
Just want to ask, sabi po Doc sa Robings that dissection daw po is unusual daw sa may atherosclerosis. Bakit po, Doc?
Ano daw? Pag may aortic dissection.
Yung unusual raw na magkaroon ng unusual raw yung aortic dissection sa atherosclerosis.
Possibly, no? Kasi if you have atherosclerosis, remember there's a deposition of fats or lipids in the intima, di ba? So kung mayroong deposition of fats in your intima, hindi kaagad nasisira ang tawag nito, ang wall, no? Or ang endothelium mo. No, kasi parang andoon ang fats. So kaya nga ang most common cause ng aortic dissection is hypertension. No, kasi sudden gush of blood, no? Mabilis na pressure ng blood, yung kakalasan ng imo wall, no? So sisira ka agad. Siguro kung mayroon doon naka-deposits na mga fats, hindi ka agad ma-open, hindi ka agad masisira, no? Kaya lang ang danger doon naman maging emboli ang atherosclerosis mo, no? Or ang plaque mo. Okay? So possibly, Ms. Makamay, so they are a reduced risk for aortic dissection, no?
Okay po, Doc. Thank you. Last na lang po, Doc, na classification. So, lahat po ba, Doc, na may aortic dissection, merong medial degeneration?
Not all.
Not all. Okay.
Not all. Mm-mm.
Okay po, Doc. Thank you.
Okay. Wala na? So I think we are time already. So I think I will have to close this lecture. So